Good afternoon. I hope you all are still awake after that heavy lunch and a cup of coffee now. So here we are with a handful of thoughts on QC challenges and solutions in clinical biochemistry. I dreamt that I was a director of a laboratory, and that's me. That's my huge lab, and that's my team. This is the quality manager who's very happy with the lot of work that he has. A technical manager not too happy with the various checks that he has to do. The senior technician seems very grumpy because he has to move between the computer and the instrument. And of course, the stores in charge was gone to sleep with the great inventory that he's doing. A stat technician who's always with jaldi jaldi karo, watching his time. Nighty manager sitting quietly on one side. And there is the head of the section who says that she just wants double the, half the CV and double the speed. And that's me again, saying, let's see what quality is all about. Quality is doing the right things and doing those things right. It is establishing conditions such that the quality of all tests performed in the medical lab assists clinicians in practicing good medicine. So, quality is invisible when good and impossible to ignore when bad, isn't it? It is said to be the sum total of all the characteristics of a service that has a bearing upon the utilization of the service to the entire satisfaction of the customer, and also conformance to the requirements of the customer. A clinical laboratory quality depends on accuracy of result, reliability, and timeliness of result. So, quality assurance in the biochemistry laboratory is intended to ensure the reliability of laboratory tests achieved by quality control. So, what is QC? It is said to be the study of those errors which are the responsibility of the laboratory and of the procedures used to recognize and minimize them. It involves a lot of statistical processes. QC is said to be a component of quality assurance. It monitors the analytical phase. It is an essential element of the QMS. Why do we need QC? Quality control gives reliability of information about patients in the form of correct lab results, and this reliability or correctness of a lab result depends on precision, accuracy, sensitivity, specificity, and appropriateness of the method used. Also, it can reject results when there is evidence of errors. You can monitor and evaluate the analytical process that produces patients' results. Most importantly, it is designed to give clinicians confidence in the methods used. So, quality in laboratory medicine is said to be fit for purpose. The right patient, the right test, specimen, cost, result, and the right reference data. Now, there are two complementary components of quality procedures, which are internal quality control and external quality control, which are backed up by precision and accuracy. So, what is IQC? It monitors the day-to-day reproducibility or precision and detects frank errors in any one day's procedure. It involves personnel, document and reagent control, instrumentation, and corrective action. ICA, on the other hand, aims at detecting constant differences between one laboratory's results and those of the others who belong to the same group, whether it is the same method and or the same instrument, and it can be obtained from international or from national body. So, accuracy is said to be how well a measurement agrees with an accepted value, and precision is how well a series of measurements agree with each other. Now, analytical errors are errors which can be picked up from a chart known as an LJ chart, which was designed by Levy and Jennings. So on this chart, you plot every day the QC result is plotted for 30 days. This is a perfect LJ chart, which you all know. However, there are causes for IQC out of control, and that could be due to random error or systematic error. This very clearly shows this is a random error. There are various reasons that cover up for random errors. Maybe all of you might be coming from very large or medium-sized laboratories, but in India, we have around 60–70% of labs which have less than about 50 samples a day. We run an ICAS program, and in our ICAS program of 10,500 laboratory participants, more than 60–70% belong to a group which runs samples which are less than 100 samples a day. So in that, some of the random errors could be misreading of the colorimeter or a wrong standard curve, transcriptional errors, wrong placing of decimal point, random air bubble, or a reconstitution of QC incorrect. You could have also calculation errors with wrong factors, power supply problems, operator technique, and the noon and the 4 o'clock syndrome. I think that's what we are now in, where the technician is unable to concentrate when it's lunchtime or when it's ready to go home. Systematic error. This is the slide which shows the positive bias on one side of the mean. You can also have a trend, a downward trend. This is another one that I'm showing you. What do you think is this? Here, there is no random or systematic. It all comes within 2SD. However, there is lack of precision. But at a particular day, a troubleshooting was done, and the points are all towards the mean. So some of the causes of systematic errors are failure to adhere strictly to recommended procedure, use of incorrect prepared standard or reagent, uncalibrated cuvettes, wrong wavelength, wrong pipette, or non-reagent grade water, filter wheel dirty, light source failed, incorrect handling of QC material, and improper temperature, humidity, and some more, and it can go on and on. It can also be equipment problems or contaminated and outdated reagent substrate kits and control. So there are some remedial reactions. You reanalyze the same control immediately, or use a fresh vial. You repeat the test using new control from a different lot. You check the reagent system, perform maintenance and rerun, and finally, you can recalibrate and then rerun the control. So monitoring accuracy and precision is very important. In a laboratory, you need to monitor the quality of distilled water, calibration of testing instruments, balances, and all those items that are required for testing of the sample, regular servicing, maintaining of equipment, use of calibrators and QC in each procedure daily. There are two important points that should be considered in selecting the IQC. The IQC material must cover the analytical concentration, normal and abnormal control. Controls produced by the manufacturer of the test or the analyzer is preferably not to be used because there can be a bias. Now coming to ICA, External Quality Assessment. It's a process that assesses laboratories' analytical and interpretative skills compared to other laboratories by testing the accuracy and quality of their results. It is said to be educational. It is an external verification of quality of service to improve quality of care. However, it is not to judge centers. So the role of ICA is to confirm assay performance, to identify poor assay performance, and thereby confirm the correction of that, and also to address issues like accuracy and precision. It is said to be a technique to challenge a laboratory's internal QC methods and procedure by means of 4 A's. That is, it should be acceptable, accessible, affordable, and appropriate. So the principles of ICA are unique and varied. Same sample sent to all participating labs, assessed for analytical accuracy, clerical accuracy of the report, interpretation of the result, most importantly, continual performance monitoring. It also provides feedback on any potential issues. It identifies imperfect practice in the lab and improves quality, can investigate factors affecting quality. Some of them are like the interferences or calibration errors, and allows comparisons, evaluation of methods, reagents, instruments in the program. This is between the provider and the lab. I think I'll just pass through this because you will be knowing this. However, lack of consistency between different methods and procedures are due to different analytical specificity, analytical sensitivity, and calibrators used for various testing procedures. The causes for failures in ICAS is incorrect handling of QC materials with regard to the reconstitution procedure, storage conditions, evaporation, incorrect procedure with regards to the mixing of the ICA, the calculation, and the unit, a wrong unit which is not corrected. Technical problems could be calibration problem, inadequate maintenance of the machine, deterioration of reagents or expired kit. Moreover, choosing wrong method or the instrument group by the lab, wrong month sample used for analysis, or results not uploaded before due date. So, these are some of the variables that might cause imprecision. Uncalibrated pipettes. This is what we have got as a feedback from some of the participating laboratories. Wrong quality of deionized water, SOP not followed properly, transcription errors. Many laboratories enter sodium, potassium, they mix up between them. Protein and albumin also goes mixed up. So you can troubleshoot ICAS by checking the method selected, the label on the vial, the unit of reporting, the conversion, and check for transcriptional error or reconstitutional error. You also can re-look at the IQC data on the day ICAS sample was analyzed, recheck if any calibration or change of reagent was done on that day, look for trends or bias. So, ICA should lead to identification of problems and whereby you can take corrective action. The benefits of ICAS are plenty. It is not for policing. It is a friendly handshake. It is not a substitute to IQC, but an additional support. It allows switching over to better methods and allows comparison of performance and results. It serves as an early warning system for problems, provides objective evidence of laboratory quality, identifies training needs, which is very important. So, a participating lab's responsibility they should choose the right scheme for their needs, analyze the ICA sample in the right time, monitor and maintain records, investigate deficiencies, manage CA, and communicate outcomes within the lab. So, participation in ICAS gives the laboratory personnel a chance to say with pride that we are a profession willing to examine ourselves and constantly strive for improvement in healthcare industry. There are major challenges in QC in achieving and maintaining and improving accuracy, timeliness, and reliability. And so, in order to have solutions, there are 12 quality essentials where an organization needs to have a vision and commitment, team building, motivation skills, and good communication, recruitment of the right staff with training, competency assessment, performance appraisal, and maintaining personal records, right selection of equipment, performance evaluation of the analyzer, maintenance, troubleshooting, and frequent service of the analyzers, good quality reagents with appropriate cost, with proper storage, and expired kits need not be used. Process control is said to be very important. Best practices of sample management in the laboratory is a must. Maintenance of a laboratory handbook is also compulsory. SOPs, policies, procedures defined by the laboratory is important with maintenance of all records. Information and management, which is by the LIS or the LIMS system, where you have patient and sample identifiers using a barcode system, either by computer or electronic based, or by paper, the manual method, which should be legible. Occurrence management is very important. Whenever there's an event with a negative impact, it has to be recorded and a follow-up has to be done. The sources of occurrences are plenty, some of which are placed here. Most importantly, it is the SOPs which are not followed with unclear responsibilities. Audits are very important, external, internal, which are systematic, independent process to determine if required criteria are met. And most importantly, process improvement, which involves continuous or constant improvement in the laboratory. You plan, do, check, and act with commitment, leadership, and participation. Facilities would include lab safety program and identification of risk. And finally, the lab customers are our physicians and patients. Feedback surveys from the laboratory to the clinicians at least once a year or once in 2 years will be helpful to the laboratory. So, finally, keys to successful quality control would be adequately trained, interested, and committed staff, common sense use of practical procedures, willingness to admit and rectify mistakes, effective communication, continuing laboratory education with regular audits. And let me bring this proverb to you. It's not because things are difficult that we do not dare. It is because we do not dare that they are difficult. So, we need a team concept. Together, everyone will achieve more. Thank you.
Thank you very much, Dr. Christudoss, for such an enlightening talk. In a nutshell, in 20 minutes, you've achieved the best quality, I can say. And we all know quality is very important. The house is open for questions, perhaps one or two.
Quality control, quality management is a topic which can be taken for 5 to 10 hours or more. To bring this talk down to 20 minutes was indeed very difficult, so it's just a handful of thoughts.
Thank you, Dr. Christudoss. Do we have any questions?
No, we don't have any standards for anyone. Any laboratory can join. We have laboratories from public health centers. We have all the 2,126 PHCs from Tamil Nadu are all enrolled in our program by the government. So we haven't put any kind of policy as who can join. Anyone who would like to join can join. We have different programs for chemistry, and however, if a laboratory is not able to pay, we do give them concession.
I want to know any criteria to become an EQUAS lab.
To become an EQUAS?
Yeah, that means all the
He's
laboratories.
asking your side.
Yeah,
Your side.
I'm a provider. We are a provider.
Provider have any criteria?
It's just that they are able to prepare it and they are able to maintain it, prepare it, and do it the right way.
Perhaps
Commitment.
if
Any?
I may interfere, the lab branding itself, brings them to this level of being a EQUAS provider.
We are a provider since 42 years, sir. We started in 1978 with only 50 labs in India. That was how CMC, we are actually a clinical biochemistry department. We 90% of laboratory work, 80% laboratory work. We have about some teaching and research. This is however only an outreach. So we are not just running only ICAS, but it's like a honorary work, So it's just like a side. It's gone up to 10,500 participating labs with a lot of lyophilization and a lot of work, a lot of programs, and it's full time. So a criteria for an ICA provider is just that they need to be competent, they should be committed, they should have good leadership, and they should have all these qualities, and then only that provider would be able to grow.
Can I add
Yes,
something?
yes,
Can I add something, please?
yes, sir.
I had
Yes.
the privilege, opportunity, and
Yes.
lucky to visit her lab a couple of occasions as an assessor from NABM.
Yes, sir, yes.
Because for a long period of time, they were running the program which did not have, it's not a must, did not have recognition as per 1704. But still large number of people were participating, they were happy, labs were happy. Because of one reason, economics. When commercial organizations were charging very heavy amount, 1/10, 1/20th of the amount they were able to provide. I don't think it would have covered their postage for years. Later on, ISO 15189 mentioned that the diagnostic laboratories should participate, not shall, should participate in the IQA program, which is accredited as per 1704. It was also not mandatory. Even today it's not mandatory. Any laboratory can participate in the PT program or IQA program, in spite of whether the provider is 17043 accredited or not. Now, accreditation, there are three drivers. One is insurance agencies. They say if it is not accredited, we will not reimburse the money. Therefore, everybody will go towards accreditation. Number two, competition between two providers. Now, Biorad was providing, then they were also providing. How will they survive? They should also come up to the requirements, whatever Biorad has complied, that is 17043. They also went into 17043. The third one is the customer's demand. If I am a customer, I demand that your services must be accredited, then automatically they will go in for accreditation. These were the drivers. That's why even though today ISO 15189 under 5.6.3 clause, I remember very well, it says under the note, the laboratory EQA provider, you should select the provider, should, it doesn't say shall, should select the provider who is accredited as per 17043. But wonderful job you are doing, compliments to you. Excellent presentation.
Thank you, sir.
I tell you, this should be introduced in the school itself. School children should know all this. It's very easy to understand.
Then our job will be easier.
Easier, yes.
Or at least in the medical school, in the MBBS programs.
Yeah, I would like to say we are the first medical PT provider in the country who has got the accreditation 5-6 years back, and the first medical laboratory as a PT provider 42 years back. And ours is a not-for-profit organization. So the criteria for being an EQA provider depends upon the organization, and of course accreditation is important now. Thank you.